This presentation is titled Stereotypes in Nursing for Nursing 609 Perspective Transformation 1 at the University of Hartford by Erica Leonard, Kathleen Yoder, Courtney Suska, and Teresa Short. After this presentation, you should be able to identify Florence Nightingale's pivotal role in nursing, obtain a greater understanding for the evolution of nursing, identify current gender stereotypes within the field of nursing, identify how nursing is portrayed within the media, identify the effect of COVID-19 on the social perception of nursing, and our recommendations for change. To begin our discussion about the stereotypes of nursing, it is essential to begin with the most influential nurse who played a pivotal role in creating credibility for the profession of nursing. Florence Nightingale was born on May 12, 1820, to a very wealthy family. The expectation of her was to get married at a young age and bear children. However, Nightingale received a calling from God to help the poor and the sick. During this time, nursing was not a respected or credible profession, so her family was undoubtedly upset about her request. With conviction, Nightingale convinced her family to allow her to receive education and become a nurse. The Crimean War was a pivotal event in history that paved the way for the development of the nursing identity. During the Crimean War, physicians were faced with a significant lack of medical supplies, overcrowding, and unsanitary conditions in military hospitals. Newspapers were reporting of the terrible state of medical care during this time, as the death rate in the military hospital was 40%. Nightingale responded to her calling and gathered a group of nurses to provide relief to the military hospitals. Upon arrival, doctors were unwelcoming to Nightingale and her colleagues as they did not want to work with females. It is during this very interaction that gender and hierarchical stereotypes are evident within healthcare. However, the need was so critical that physicians had no choice but to depend on Nightingale and the other nurses. With their arrival, they brought provisions to increase supplies, placed a focus on nutritious food, and significantly improved cleanliness and sanitation. Through their strong efforts, the death rate of the military hospital was significantly reduced to 2%. Prior to standardization of nursing, there was no professional training for nurses, as nursing was not a credible profession. During the late 17th century and early 18th century, war created significant need and was the catalyst for expanding and standardizing the career of nursing. During this time, it was commonplace for nurses to provide services near battlefields. In the mid-18th century, the nursing field was recognized by Dr. Joseph Warrington, who founded the Nurses Society in Philadelphia and published the Nurses Guide to help set standards and improve nursing. Furthermore, Catholic nuns were pivotal in advancing nursing in the United States, as they opened almost 500 hospitals following the Civil War. Moving into the 19th century, it was a social reform that played a significant role in advancing professional and training opportunities for women in nursing. The social reform movement also played a critical role in changing attitudes, as it was not commonplace for women to work outside of the home during this time. The social reform movement was pivotal for women, but equally as pivotal for the field of nursing. Prior to the 20th century, the focus of nursing code was on obedience to physicians, as the profession had not established professional credibility. It was not until the mid-20th century that hospitals hired nurses as regular staff on a permanent basis, and nursing was recognized as an essential healthcare service. Again, it was war, particularly World War I, that amplified the critical need for the skill set of nurses. Additionally, it was during the 20th century that a focus of specialization within the field of nursing began. During the 21st century, the role of a nursing professional evolved from a subordinate to an independent stakeholder in healthcare delivery. Specialized nursing continues to evolve in modern-day nursing and enables hospitals and healthcare facilities to deliver more efficient, less costly, and safer healthcare services. However, stereotypes and inequity are still common themes faced by nurses in the 21st century. In a hierarchical system of power within the practice environment, nurses are still not recognized as being a top stakeholder. Amidst the significant growth made within the nursing field, there is much work left to be done.
Gender stereotypes are seen frequently in today's nursing world. The word nurse is derived from the Latin word nutri, meaning to nourish, and nutrix, meaning nursing mother. This changed to the French word nutrice, which was shared with the English and underwent changes, becoming the broadened meaning, a woman who cares for young children and those who care for the sick. Florence Nightingale was a tender and compassionate woman, with her actions being dictated by her Christian duties. This model is how nursing became considered to be a nun-like activity. It also influenced the public's view of nurses being angels and angel-type figures. This has made it extremely challenging for men to enter the world of nursing. The stereotype that nursing is a woman's profession has challenged men from entering the profession and once in the profession. In particular, men who enter the profession are stereotyped as homosexual, expected to climb the ladder to a better career, or challenged to resist the stereotypes. Many men are assumed to be homosexual based on the nature of nursing and the characteristics that describe nurses, such as compassion, caring, and loving. The nature of nursing also brings in a different challenge for men: touch. Touch plays a large role in nursing. Men can have their touch misinterpreted, leaving them in vulnerable situations. Men are seen as masculine and typically in leadership roles. This notion is what brings most to expect men in nursing to climb the ladder. Society sees nursing as a lesser career than management. Many see nursing as a career not fit enough for a male, which in turn amplifies the notion that men will climb the ladder to leadership or management. With some male nurses not having the desire to climb the ladder, they are forced to resist the stereotype. When resisting the stereotype, men are frequently questioned about their choices and not supported by their employer or loved ones. Those male nurses who are questioned about entering the profession have a strengthened desire to succeed in this profession.
Many of these nursing stereotypes are developed through the representation of nurses in the media. The media has often portrayed the nursing profession in a negative light. Much of what people learn about the nursing profession comes from the media. A study suggested that 9 in 10 regular viewers of popular television medical drama learn health information from it. It is easy to see how the public can perpetuate inaccurate health information and skew the image of the roles of nurses. The rise of social media as a platform has bolstered the use of memes that often misrepresent the nursing profession. 4 stereotypes often seen in the media are the naughty nurse, the doctor's handmaiden, Nurse Ratched, and an angel. The naughty nurse creates the image of the hypersexual nurse seeking the doctor husband who often engages in sexual activity while on the job. Not only is this role commonly played on sitcoms, but it often translates over to the sexy nurse outfit during Halloween time. The handmaiden. Nurses continue to fight the perception that they are there to serve doctors, rather than being seen as someone who provides attention to detail and utilizes critical thinking to ensure best patient outcomes. Next, the reference of Nurse Ratched, which originates from the popular movie One Flew Over the Cuckoo's Nest. This character represents an angry, sadistic nurse who is looking to pronounce her patients. On the opposite spectrum, nurses are imaged as angels. The angel reference identifies nurses as people who give to others without reservation. It negates substantive reasons why many people choose nursing as a career, such as the satisfaction of having a scientifically challenging job that combines both an analytic and a humanistic approach, the opportunity to work with a team with other health professionals, or receiving well-deserved salary, health, and vacation benefits. Nursing continues to work towards educating the public on what it is nurses really do. The media has failed to depict how important the nursing role is. The focus is to shift the perception of the stereotypes to being seen as educated professionals that are capable of providing quality care that includes critical thinking. Nurses play a pivotal role in patient outcomes. These achievements often go unspoken or unnoticed while doctors are valued and seen as gods. Summers and Broom mention the truth about nursing organization that has generated substantial media coverage for its issues and has gotten many high-profile ads improved or removed over the last 2 decades. With the use of expert commentary, conferences, roundtables, and advocacy campaigns comes the hope to achieve better public understanding of the nursing role and debunk the stereotypes created that hurt the profession as a whole.
There is no better time to change the image of nurses than during the highly publicized COVID-19 pandemic. However, during this time, nursing as a profession has struggled to find their voice. First, it must be noted that there is a significant lack of nursing presence on many community and government COVID-19 response boards. This is glaringly evident when looking at the White House National Coronavirus Task Force. There is no representation from nurses. Nurses can make a good addition to these task forces as they are the ones who are the voice of the patients and have unique understanding of how the policies and procedures directly affect staff, patients, and their family. While there's been an overwhelmingly positive response to nurses and the role they play in the COVID-19 pandemic, we are still seeing old stereotypes, such as nurses being highly sexualized or portrayed as angels. Just looking at the top left picture, you can see that there are 2 white women with angel wings. And while there is an image of an African-American male, he is standing behind the women with his face partially obstructed and wearing a different colored scrubs. On the contrary, we have seen an increase in nurses speaking out more to the media. They are often speaking out to shine light on things such as the lack of PPE or staffing. They are the ones who are able to give and portray a humanistic report on what patients are feeling and how they are the ones that are truly spending the majority of the time with the patients. We've also seen the media with an increase in the ingenuity that nurses have had during this pandemic. The media has shown nice coverage over how nurses have altered hospital rooms to allow for pumps to be outside the room for less time being spent in isolation with the highly infectious disease. We've seen nurses using dry erase markers to write on the doors and windows of the patient's rooms in order to communicate with the other parts of the medical team outside of the isolation rooms. We've seen nurses use rolls of tape to thread their tubing through to keep their lines from getting tangled or kinked due to the extra tubings to keep the pumps outside the room. The opportunity for nurses to change society's perception is now. Now that we know how nursing began, how it evolved, and some of the long-standing stereotypes, we can talk about how to make change. First, there needs to be an increase in diversity within the profession. With greater diversity, we can change the unconscious bias of society that all nurses are angelic white women. In modern day nursing, we have seen a greater push for the bachelor prepared nurse. This will let society know that they are well-educated professionals. Nursing must also work towards the challenge of being able to charge for the care they provide. Medicare, at this time, lumps nursing care under the general room and board charge for in-hospital nursing. Hopefully, through the documentation of nursing care plans, nurses will be able to quantify the care that they provide, and hospitals will soon be able to be reimbursed for the nursing care provided. Next, there needs to be a greater representation of nurses on hospital boards, public health boards, and government health agencies. As said before, nurses are the voice of the patients, and they are the ones who are closest to understanding how the effects of policies and procedures are on the rest of the public and the patients. One complaint from the media is that they do not know how to contact the nurse experts.
If nursing organizations had formal databases of their experts posted on their websites, it would be easier for the media to contact them. Nurses must also stand against ill-portraying nurses played out in the media. That means that the nurses must be their own advocate. They need to write letters stating that the profession will not stand for the continued sexualization and subservience of nurses. Lastly, nurses must hold themselves to a high level of professionalism. They must start referring to themselves as their nurse when introducing themselves to patients or family members. They must be educating their patients as well as the public on what to do in order to take credit for the work they have done. Nurses must also stop saying that all their hard work is just their job. They should be able to accept credit for what they've done.